Hi Syracuse, hey Central New York, Gwenn McDonald here at Blue Pelvic Physical Therapy located in the heart of Baldwinsville, New York. In fact, if you drive by over the bridge and you go past the barbershop, she's in that same strip of the building, so she's right up on top. This is Dr. Elizabeth Auburn, who is a physical therapist that primarily deals with your pelvic floor. What exactly is that? I mean, I know what the pelvic is, but like, who do you help and why?
So I have a small clinic located in Baldwinsville, dedicated only to pelvic floor physical therapy, meaning that most of the patients I see are coming in with issues with urinary incontinence, leaking urine, doing things like exercising or coughing and sneezing and having leakage. I also see things and help people that have constipation, that have pelvic pain, pain with intercourse, pain with exercise that's more located in the pelvic area, where you might think, oh, you know, I would see an orthopedic physical therapist, but I'm not really sure if they are kind of understanding where some of these symptoms are actually originating from. Certainly I see people of all ages, as far as, you know, a lot of times people think, oh, pelvic floor physical therapy, that's just for having a baby or before having a baby or after, but really, you know, everyone has a pelvic floor. And we have it for all of our lifetime, and thinking about things that we want to be able to do well for a lifetime include things like peeing and pooping and having those kind of under your control. And so specializing in pelvic floor physical therapy is a way that we can use kind of exercise, education, some modalities to help improve those areas. So those are things that you have control of and you're confident with for your lifetime.
So it's not just for women who have just had a baby, or for women who are perimenopause or menopausal or older. Like if when I'm playing with my kids and I'm playing basketball and they're super aggressive, the next thing I know, I'm like, oh my gosh, and you don't want to go to the doctor for that. Is that something you need? Do you need a doctor's note to see you, or a referral?
So in New York State, after 30 days, we need a script as far as attending for physical therapy in any avenue, any kind of physical therapy. But for the initial evaluation and the first 30 days of treatment, you are able in New York State to have something that's called direct access. So if you're not sure, or you're wondering if your symptoms might be a good fit for this, you can always call and schedule an eval, and you wouldn't need your doctor to write a script until, like I said, within 30 days of that. And that, you know, we can get scripts from someone's primary care, someone's GYN, urologist, chiropractor, anyone that is a provider that might think that would be beneficial.
Wow, I didn't realize that.
Mm-hmm.
Do you help men?
I do.
See?
Because everyone has a pelvic floor.
See? That's awesome. And you're literally in the heart of Baldwinsville. And if somebody wanted to reach out to you, would they go to bluepelvic.com, or what's your website?
Yep, absolutely. They could go to www.bluepelvic.com. And there's contact information there. I am right in the heart of Baldwinsville. I usually tell people not too far from the Beeville Diner, because everyone knows where that is. And I just have a small, nice private clinic where, you know, all the sessions are an hour long, so we can actually get to not only what happened in that week, but kind of how you're feeling and what you are hoping for in the, you know, in the future as far as goals and stuff like that.
And you do a lot of core muscle therapy and exercises.
You know, the pelvic floor, people will say, is the floor of your core. So thinking about your abdominal canister, that pelvic floor is the bottom of that abdominal canister. So it all works together. You know, we can't really isolate one thing and just say, oh, just do squeezes, just do Kegels, and you're going to be set for not leaking for the rest of your life. That's kind of like saying, oh, if you just do bicep curls, then you'll be able to shoot free throws perfectly for the rest of your life. And you're like, can't be right.
Right, you need a little bit more behind it. So.
Yeah, absolutely.
So when the Kegels aren't working, or if you want to preempt it and come here and just have a really good core workout and have the benefits of a strong pelvic floor, this is who you should consider seeing.
Oh, thanks, Gwenn.
I'm Gwenn McDonald from Around Syracuse Realty, showcasing another small business here in the Baldwinsville community. Thanks, Syracuse.
Thank you.